We have with us Kathy Greenlee, the Administrator for the Administration for Community Living and the Assistant Secretary for Aging at HHS. Kathy, thank you so much for joining us.
I'm glad to join you today, Amy. I'm looking forward to our conversation.
As am I. Tell us, what does the Administration for Community Living do?
Well, the Administration for Community Living is a brand new federal agency. We've been around since April of this year, 2012. And we brought together existing organizations within Health and Human Services, the Administration on Aging, the Administration for People with Developmental Disabilities, and the Office on Disability into a new umbrella agency. And our mission is to help support the independence and the safety and the health of individuals with disabilities and seniors so that they can always be active members in their own families and communities. And because families are so important, quite naturally we do a lot of work in the field of family caregiving. So it's an important topic for us, and I know something that we share in common.
Absolutely, an important topic for the Parkinson's community. What do you do to support caregivers? Do you have programs directly for caregivers? Do you work with state and local governments? How does that structure in the caregiving aspect work?
Well, for us, because we work with people with disabilities and seniors both, caregiving is fairly broad and can include adults caring for children who are caregivers. But for our conversation, let me talk about adults caring for other adults, either they're seniors, they're elders in their family, or their partners and spouses. I think the best way to describe what we do is to focus in three different ways. There are direct services that we provide to family caregivers. That's done primarily through the National Family Caregiver Support Program. That program has been around since 2000. It's 12 years old now. It provides direct service and support for caregivers, their unique needs, so we can do an assessment for the caregiver. The most common support that caregivers ask for is respite, but they often need information about what other services are available in a community, help with other kind of supports. And that's a direct service to the caregiver themselves.
How do people find out about this program and make use of it?
The best way for them to find out is to call one of the area agencies on aging in their community or an Aging and Disability Resource Center. These are Older Americans Act programs. We deliver the money from the federal government to the state, and the state distributes it to the local area agency on aging or Aging and Disability Resource Center. And that's the way caregivers can get direct support. There are two other ways, though, that we provide support for caregivers that I think are very important. One is we look at systems and structures. I mean, it's important that all of the different caregiving and respite services in the state know about each other. What we hear from caregivers is the difficulty in finding services. So the Lifespan Respite Program, Lifespan Respite Act, is another program that we administer. And it really does cover the lifespan. It was passed in 2006, has been administered by the Administration on Aging. And the purpose there is to build coalitions and networks in each individual state so that they can do kind of systemic work within a state to make sure they're coordinated. The third way we support caregivers is we support the care recipient, and I think that can't be overlooked. That when we talk about respite services, they're often episodic in nature, so someone quite naturally can get support or a break, but often it's the day-to-day grind of caregiving. That when I talk to caregivers themselves, through the Older Americans Act, we provide adult day services through some of the in-home support programs. We can have home-delivered meals delivered. So part of the support of the caregiver is to look at kind of their whole situation, including the care recipient. And if the care recipient is 60 years old or older, we will have direct services for them as well.
There is a segment, a significant segment of the Parkinson's disease population that is not elderly.
Yes.
It's the young onset population. Does that make it harder to take advantage of some of these caregiver programs? Do you have to be elderly?
For the National Family Caregiver Support Program, the first program that I mentioned, because it's designed for the caregiver, it does kind of require that the caregiver be at least 60 years old or older. We have been working to try to get this law, the reauthorization, passed of the Older Americans Act, so that we could broaden that a bit so that someone could care for a younger adult who also has a disability, which is what Parkinson's would be considered. That would take a change in the law. So our support for kind of a non-senior, non-60-year-old family would be the more systemic supports that we've talked about, like working directly with other kind of programs within the state to help coordinate and build.
Is there a variation from state to state in terms of what kinds of programs are out there, resources devoted to these programs? I would imagine it's quite a bit of it.
There's tremendous variety, which is part of the, I think, push behind the Lifespan Respite Act. I mean, the goal of the advocates when they worked with Congress on the act was to eventually get to the point where we could provide respite services and there would be enough funding. But the law was passed without that level of funding. We have been able to tackle the variations between states by working kind of in a more systemic coalition way. But it does vary state to state, and so people really need to look at what's happening in their specific community and their specific state.
And in this time of tight resources, are you seeing states pull back in this area?
Yes and no. I mean,
Good.
Part of, when you talk about caregiving, there's the informal kind of volunteer nature of caregiving. The numbers that we use that are most common is that 80% of the long-term care in this country is provided by family caregivers, and that's often seen as an informal support network. But we also spend a tremendous amount of federal dollars and state dollars on providing services to people who need long-term care. And in those services, we're seeing continued support for community-based services, continued support for the care recipient, continued need to help the care recipient by helping their caregiver. All ends in the same place, but often two different paths.
So I'm glad to hear it's not being cut back as much as we might fear. Certainly we talk a lot about, we hear from caregivers the need for respite care, but also for employer protections. And I know the Family Medical Leave Act has been in place about 20 years now. Has that made a difference? Has that made it easier for caregivers to balance their responsibilities as an employee and as a caregiver family member?
You know, I must admit I'm not the best expert on the Family Medical Leave Act, but I know the same thing that you do, that it's been around for 2 decades. And the issue of employment is a significant issue for caregivers. And there was a reason that the Family Medical Act was broad enough to include caring for an elder, not just caring for a child. That the responsibility of someone to stay employed, to be able to take time off, whether they're caring for a spouse or caring for a parent, is critically important to their sort of both mental health, their economic security, and their ability to live in both worlds, that of caregiving and employment. So a supportive employer is a very important kind of aspect of the whole realm of what we need to do to help family caregivers.
We all talk a great deal in the Parkinson's community, but more broadly as a country, about the aging of the baby boomers and the graying of society. What are some of the, looking in the future, policy issues and challenges you see for caregiver issues as we all age as a society?
Well, I'm very hopeful and optimistic that caregiving can actually help this dynamic, that we can't as a society afford to pay for long-term care for the baby boomers with government resources, that we must continue to support a network where families do what they are choosing to do now, and that's care for their loved ones. And in order to help families do that, we need to just continue to talk about what family caregiving is, help caregivers identify that they are caregivers, because as you know, people don't use that name to describe themselves. I'm the wife, I'm the daughter, the son. And continue to come together and talk about the fact that no one really expects someone else to bail them out. They're willing to provide the support, but there are things that they need so they can stay at it. And some of those needs are very basic, like respite, or other kinds of support, or the ability to stay employed. I believe both the boomers themselves and the age wave coming and the people providing care will help reshape the future and continue to support people living in their communities for as long as possible so that they can stay engaged with their families and their communities. So I'm very hopeful about the power of family caregivers in bringing these issues forward. It's very much needed.
In addition to what people can do to reshape in a volunteer basis by helping in their communities, what can people do who want to reshape policy in this area a little bit, and how can they get involved in their communities to make their needs known and the needs of other caregivers they care about? What can they do to advocate?
I'm smiling because I actually have a difficult answer for you.
Okay.
Because when I talk to seniors themselves, and I know we're talking to the Parkinson Action Network, so we're talking about a very specific section of people with caregiving needs. What I tell people they need to do most is admit where they're failing. And I think that's the hardest thing to ask someone to do. That family caregiving can be a tremendous burden. physically, psychologically, financially. And it's very difficult sometimes for people to step forward with a policymaker at any level and say, I'm really struggling. I need some help. So for people
publicly
to be
saying, I may be letting my loved one down.
People don't need to follow legislation. You can help them do that. They need to talk about their lives and what they hope for, but they also must talk about what they're struggling with. And I think that is the hardest thing we can ask people to do.
That is hard, but that's also very good advice. And thank you, Kathy, so much for joining us. Really appreciate it. Very interesting.
Thank you.